The following video will focus on emergency care for the adult casualty who is 8 years and older.
Good day. My name is Nick Rondinelli, and I am a first aid and CPR instructor trainer for the Canadian Red Cross. Welcome to the CPR educational video.
When the breathing stops, the heart will soon stop beating. 0 to 4 minutes, clinical death. 4 to 6 minutes, brain damage possible. 6 to 10 minutes, brain damage likely. After 10 minutes, irreversible brain damage, biological death. Are you prepared?
And no pulse? Okay, resume CPR.
Come on, Dad!
In this video, you will learn life-threatening emergencies and the life-saving techniques to deal with them.
In this video, you will learn rescue breathing for respiratory arrest, which means the person has stopped breathing. You will also learn how to perform CPR, known as cardiopulmonary resuscitation, for cardiac arrest, which means the breathing and the heart has stopped. Cardiovascular disease, such as heart attack and strokes, is still our #1 killer. This video will teach you how to prevent, recognize, and treat for a heart attack or stroke. You will also learn how to clear an airway obstruction for a choking situation.
Let's begin.
If you come across an emergency situation that requires your immediate attention, the first thing to do is stay back and check the area for danger.
Approach the scene if it appears to be safe. If it is not, stay back and call 911.
Once you've determined that the area is safe, approach the person and try to wake them up by gently tapping them.
Tap or gently shake the person and shout to see if the person responds.
If the person does not respond, immediately call 911. If you're by yourself, you'll have to make that call. Otherwise, try to get someone else to do it.
If the person does not respond, have someone call 911 or make the call yourself.
Once you're confident that 911 has been called, the most important thing to do at this point is open the person's airway, check to see if they're breathing, and check to see if their blood is circulating. In other words, if their heart is still pumping. An easy way to remember this is your A, B, C check, and this is how you do it.
Begin an A, B, C check for life-threatening conditions. A. Airway.
Open the airway using the head tilt, chin lift method.
Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway.
Let's take a look at that on a model.
B. Breathing.
Check for breathing by looking at the chest and feeling for air.
Check the breathing by looking at the chest, listening and feeling for air for up to 10 seconds.
If the person is not breathing, give 2 slow breaths.
When giving 2 slow breaths, keep the airway open, seal the nose shut. Place your mouth around the person's mouth with a tight seal. Give 2 breaths, each lasting 2 seconds. Make sure the chest rises. Use a breathing barrier when possible. C. Circulation.
Once 2 breaths go in, check signs of circulation.
Check for signs of circulation by looking for movement, effective breathing, coughing, and appropriate color of the skin.
For the more experienced rescuer, you may also check for the presence of a carotid pulse. To find the carotid pulse, place your 2 fingers on the windpipe and slide them toward you onto the groove at the edge of the windpipe. Check for circulation for no more than 10 seconds.
Let's review the airway, breathing, and circulation check.
Open the airway using the head tilt chin lift method. Check for breathing by looking at the chest and feeling for air for no more than 10 seconds. If the person is not breathing, give 2 slow breaths. Once 2 breaths go in, check signs of circulation by looking for movement, breathing, coughing, and appropriate skin color for no more than 10 seconds. For the experienced rescuer, you may also check for the presence of a carotid pulse.
Things to consider.
Tip 1. Open the airway with a jaw thrust if a head or spinal injury is suspected. Lift jaw upward using index fingers. Be sure not to move the head and the neck. Tip 2. To prevent disease transmission, use protective equipment. A breathing barrier should be used if you feel any risk. Tip 3. If the person is breathing, place them in the recovery position. Take the arm closest to you and lift it above their head. Grab their leg and their other arm and bring them gently to their side. Once they're on their side, monitor the breathing and keep the airway open. And await arrival of emergency medical personnel. Tip 4. If the person begins to vomit, place them in the recovery position. The recovery position will prevent aspiration or choking and keep their airway clear. Please pause the video and discuss how to perform an airway, breathing, circulation check, and the importance of it. Let us learn now when and how to perform adult rescue breathing. Always begin with an ABC check. Following the 911 call, open the person's airway, check to see if the person is breathing, and if they're not breathing, give them 2 slow breaths. Once the 2 breaths go in, now check for signs of blood circulation.
If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over, you are too exhausted to continue, the person begins to breathe or vomit, the person loses signs of circulation, the area becomes dangerous.
Please pause the video and discuss the meaning of respiratory arrest and why we give rescue breathing. Let us now learn when and how to perform adult CPR, also known as cardiopulmonary resuscitation. Did you know when the breathing stops, the brain begins to die in 4 to 6 minutes? The average 911 response time is 9 minutes. Without immediate CPR, the person has little chance of survival.
If the person is not breathing and they have no signs of blood circulating, this means that the heart has stopped pumping blood around the body. So what we need to do is immediately give the person chest compressions to circulate the blood and breaths to oxygenate the blood. When you combine chest compressions and breaths, you're doing CPR and you're helping to keep them alive.
Signs of no blood circulation include unresponsiveness, no breathing, no coughing, no movement, bluish color of the skin, absence of a carotid pulse. If you are unsure whether the person has signs of blood circulation, don't delay care. Just begin CPR.
If the person is not breathing and has no signs of blood circulation, initiate adult CPR for cardiac arrest.
To find the hand position, place the heel of the hand 2 fingers above the bottom of the sternum. Crawl up the ribs, place 2 fingers above the bottom of the sternum, and plant the heel of your hand above the 2 fingers.
An alternative way to landmark or find the hand position when doing CPR is to take the heel of the hand and place it directly in between the chest muscles, also known as the lower half of the sternum.
When giving 15 compressions, keep your arms at a 90-degree angle to the body, keep elbows locked, compress sternum 1.5 to 2 inches, do 15 compressions in 9 seconds, about 100 compressions per minute, keep fingers off the chest.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will force the blood out of the heart and circulate it throughout the body. Give 2 slow breaths to oxygenate the blood now. Continue 15 compressions and 2 breaths for 4 cycles. CPR circulates and oxygenates the blood. It helps to keep the brain